Hi guys, my name is Dr. Haroon. I'm a cosmetic doctor who specializes in non-surgical injectable treatments. In today's video, you'll understand a little bit about what non-surgical treatments entail and what kind of results you can expect to achieve. Today, what we're looking to do is take you through a consultation with one of our clients and carry out a treatment as well. The treatment that we're looking to do today is mid-face rejuvenation or cheek filler. And what that entails is adding filler to the cheeks to rejuvenate the mid-face and also add lift and contour. An attractive look for a female is high arched cheekbones, which is what we're hopefully looking to do today. All right, Katie, so we've done the medical part of the questionnaire. What I'd like to do now is talk a little bit about the treatment goals, why we're doing the treatment and what you can expect. All right, what I'd like to do first is talk a little bit about aging. So when we age, it's a very typical pattern that everyone's face follows, okay? It's quite complicated, but I'll try and simplify it for you, okay? So we start to age from our cheekbones, okay? So our cheekbones start to lose volume. And then what that does is it makes our face, which was nice and oval, nice and heart-shaped when we were younger, it starts to just become more and more square, which for men it's great as they get older, but unfortunately for females, it makes their face look a bit more masculine. Also, it has some secondary disadvantages as well. So the cheeks, I describe them as the shelves of the face, okay? It supports everything lower down. And as we start to lose our cheekbones, everything starts to slowly sink down, okay? And what that presents as is lines from the nose to the mouth, mouth to the chin, and it starts to show some jowling as well. Maybe later on in the 40s or even 50s that starts to present. Now, the good news is the treatment that we're doing today, we're placing a gel-like substance where aging has occurred. So it's a thick filler against the bone and then a softer filler in the superficial plane. What that does is it makes your face more heart-shaped from the front, okay? And it also supports the lower down structures. So you'll start to noticing softening of your nose to mouth lines, mouth to chin lines, and also softening of the jowling as well, okay? So a few risks with this treatment, with any injectable treatment: swelling, bleeding, and bruising. They're all quite common with any injectable treatment. There's always a risk of infection, but we tend to go over the top when it comes to cleaning. And of course, we use sterile needles as well. Now, the other thing that I'd like to mention, which is probably the worst thing that can happen, is something called a vascular occlusion, which is basically a blocked blood vessel. So I'm gonna scare you first and then I'm gonna reassure you, okay? What it is the filler can block a blood vessel directly or indirectly, okay? Leads to lack of blood flow to a certain area of the face. Leads to tissue death. Worst thing that can happen. The signs are quite obvious. It's pain that gets worse as the day goes on. So when we do the treatment, it might be a bit uncomfortable, but after we're done, there'll be a bit of tenderness. You won't be in agony, okay? If you are, you give us a call, we come out and see you. If we think there's a blocked blood vessel, we'll put some reversing agent in there and it completely resolves the blockage. No long-term consequences, okay? Chances of that happening, you know, for the general population is 1 in 15,000. Because we're doctors, we tend to know the anatomy quite well, so it's closer to 1 in 100,000. The cheeks, low risk area. It's extremely rare. Does that all make sense so far? So we'll be using two different types of fillers today, okay? So the first one is Teoxane Ultra Deep, and basically what you need to know, it's a thick gel-like substance, okay? And we'll be injecting it against the bone. Why? To emulate bone. It's really thick, really viscous, so we're looking to emulate the bone, okay? So we'll inject it quite deep, all right? Now, the other filler that we'll be using is Teoxane also, but RH3, okay? Which is a softer product, which emulates the tissue that sits on top of your cheeks, okay? Very soft, very natural product. And we'll be overlying that just under the skin, which again will give a very natural result. Typically, these fillers, what the manufacturer says, last up to 12 months. In our experience, I'd say it's closer to 18 months. So if you're happy to go ahead, the next steps are, I'll put some numbing cream on your cheeks. Takes around 10 to 15 minutes to reach maximal effect. Then I'll cleanse the area and then we can get the procedure underway. In the meantime, do you mind if you just complete some paperwork as well?
Of course.
Fantastic. So that was it, guys. That was a consultation as well as a treatment. The treatment was mid-face rejuvenation or cheek filler. As you can see, the result is pretty good on the day, but I always say to our clients that it takes a full 2 weeks to see the final result. Now, the reason behind this is that there can be some swelling and some bruising on the day, which takes a couple of days, sometimes even a couple of weeks just to settle. We used a number of different techniques, including injections down to the bone and a fanning technique across the superficial layer of the skin, which gives a really natural result, also a long-lasting result. Typically, these results will last anywhere between 12 to 18 months. If you'd like to know anything more about this specific treatment or any other treatments that I may be able to help you with, please get into contact with us. Thanks a lot, guys.